webinar titled Applying the Public Health Approach to Recreational Boating Injury Prevention, Ensure Widespread Adoption. My name is Krista Thalen, and I'm a program coordinator at the Safe States Alliance. On behalf of the Safe States Alliance and the National Association of State Boating Law Administrators, or NASBLA, as I will continue to refer to them, we thank you for joining us. During today's webinar, we'll cover the Injury Violence Prevention Core Competencies, number 6, ability to disseminate information related to injury and/or violence prevention to the community, other professionals, key policymakers, and leaders through diverse communication networks, and core competency number 7, ability to stimulate change related to injury and/or violence prevention through policy, enforcement, advocacy, and education. This is the last webinar in the series of Applying the Public Health Approach to Recreational Boating Injury Prevention. The purpose of these webinars is to provide a first step in equipping NASBLA members and partners with resources to take a public health approach to their work. Before we begin, a few housekeeping notes. For this webinar, we are using the built-in audio. Please make sure that you have used your mute button so that no one on the conference call can hear you or any background noise during our call. To allow our presenters to share their information and insight with us with little interruption, we will save questions for the end. You will be able to submit questions by typing them in at any time throughout the webinar by using the questions area of the webinar control panel. At the end of the webinar, we'll have time for general Q&A with the presenters. Lastly, following today's session, you will receive an email with a link to an online evaluation. Your comments and suggestions are very important to us, so please take a few minutes to complete this evaluation. This will also be extremely helpful in planning future events. I will now introduce our speakers for today. Our first speaker is Tony Gomez, Manager of Violence and Injury Prevention at the Public Health Seattle in King County, and he's also a clinical faculty instructor at the University of Washington in the School of Public Health. Mr. Gomez has worked in the public health injury prevention field for over 30 years and has published numerous papers on drowning prevention, firearm safety, traffic safety, and other public health issues. He currently serves as an at-large member on the Safe States Alliance Executive Board and co-chairs the Policy Committee. He established the Seattle-King County Traffic Safety Coalition in 1998 and still serves as project director. He co-established the Washington Statewide Drowning Prevention Network along with leaders from Seattle Children's Hospital. Next, we'll have Elizabeth or Tizzy Bennett, Director of Community Health and Engagement from Seattle Children's Hospital. Tizzy has led a number of drowning prevention and water safety programs for over 25 years, including the Stay on Top of It campaign to increase life jacket use, Washington State Drowning Prevention Network, Everyone Swims, development of life jacket loaner programs, and a multi-year statewide policy and systems change strategy. She has a master's in public health and is a master's certified health education specialist. Following Tizzy, we will have Ron Sarver from NASBLA. Unfortunately, Pam Dillon will not be able to join us today. Ron began his career with NASBLA in 1993. He has worked in many aspects of the association, including staffing policy committees such as vessel identification, registration, and titling law enforcement and preparedness and response. Ron now serves as the association's deputy director. He oversees public policy development for NASBLA and has nearly 30 years of association experience, having also worked with the Council of State Governments, Southern Governors Association, National Emergency Management Association, Environmental Control Council of the State, and the National Council of State EMS Training Coordinators. He earned the Certified Association Executive Credential in 2010. A native of Virginia, Ron attended Berea College in Central Kentucky and graduated from Eastern Kentucky University with a degree in journalism. His favorite boating is on a catamaran anywhere in the Caribbean or on a snorkeling cruise on the Great Barrier Reef. Without further ado, I would like to turn the presentation over to our first presenter, Tony Gomez.
Thank you, Krista. Let's see, can we get an advance on the next slide? Let's see. Not getting this to work. There we go. All right. So I just want to, at the outset here, thank Safe States, Krista, Julie Alonso, NASBLA for this excellent series and inviting us to present. Our work's going to be informed by local efforts as support of state and national efforts on boating safety education, life jacket laws, boating under the influence laws, some of the closure work we've done with certain bodies of water that are dangerous continually or at certain times of year, and some work we did with the Governor's Commission a number of years back where we looked at some drowning issues in our state park system related to both open water swimming and boating, and some recommendations that came out of there, including establishing a risk management system in the state park system. So I'll be reviewing some of the public health framework, including some of the ones presented previously on orientation, but I'll weave that with examples of our local and state work. So I'll discuss current and past work that may be helpful to the audience. And one of the things I'll kind of come back to it at various times is within that public health framework is kind of a theme called assurance, which is making sure that the various issues are getting addressed. And so whether that means we co-lead or lead an effort, support it, or are just aware of it, that's part of what our local work entails. So as we've seen different versions of the public health approach, one of the key things we do is gather data to understand the scope of the problem and its impact on population health. And that's really a big framework as to what are we trying to do to affect the population health and safety in our community. So this data gathering part is also known as surveillance, and it's not surveillance in terms of observing or watching. It's an epidemiological term, a data term for gathering data from as many different sources as you can and determining what will be helpful. It's also known as assessment. So we'll talk about that as part of this framework as well. Then with that good data, we identify the known risk and protective factors through literature reviews, work that's been done, and this kind of part of the public health approach is also known as policy development. So Jamila, Dr. Porter did a great job with kind of describing big P, little p. So big P might be federal or state law change. Little p might be something that an organizational change that's going to have some impact. And then this works up to working with those that are most affected by the issue to design, implement, and evaluate interventions. So this framework also includes the assurance that I mentioned, as well as administration. And, you know, how do you put in the infrastructure in order to make all these things happen? You know, it's not unlike in the law enforcement community, the problem-oriented policing system approach, where you do have good data, you look at the issue, you gather those that are affected, and you work on implementing and testing efforts. We've seen the Prevention Institute's work referenced a few times in the webinar already, and I encourage you to go to their website. They have some excellent documents and helpful things on traits of task forces and whether you're a coalition or a task force and what are traits of effective work in that area. So one of the things, excuse me, we do within this spectrum is we try to make sure that all the levels are addressed. So starting at the bottom, strengthening individual knowledge and skills. It may be, for example, our annual April Pools Day, where we do water safety at as many local swim pools as we can, and it includes a boating safety component, life jackets, lessons. So I'll describe a little bit of that work later. Promoting community education, maybe media releases, identifying data issues, changes in policy, general lessons that need to be thought about that we can help disseminate through mass media. With educating providers, our provider groups could include law enforcement, other public health professionals, and we might be educating them about available resources, like when Seattle Children's and Seattle Parks does their life jacket sales. We'll try to help get that information out through social media. Certainly our Washington State Drowning Prevention Network work in terms of fostering coalitions and networks, and we're fortunate to have such great support with Seattle Children's, our state parks boating programs, our Department of Health, and some of our local leaders in that. In terms of organizational practices, it may be, for example, getting life jackets into all swim lesson programs, so folks are getting comfortable with, using those life jackets in pools and open water. So those are some examples of changing organizational practice. And then at the top level is influencing the policy legislative work, and for instance, that's when we get the statewide network working on boating under the influence law or a life jacket for children law or other substantial changes that'll lead to some of those population improvements that we're looking for. We're fortunate to be allowed to work within a lot of different policy realms at the local agency, and I encourage you to think about how you yourself, both individually and organizationally, can be involved in policy. It's really not that scary. You saw an earlier survey that showed most of the participants on webinar 3 didn't have much or limited policy evaluation experience. So you can overcome that by teaming up with some experienced policy people. Within this, we'll work on our state and local boards of health. So it may be a resolution, for example, coming out of one of our boards that supports whatever the item is, and then we can work that up to a local or city county ordinance. For example, our city of Seattle now prohibits water skiing in just a congested, dangerous area, and so that's eliminated injuries in that area. It also prohibited swimming in the Lake Washington Ship Canal, which is a ship canal, so it's not an ideal place to be swimming anyway. So it improves boating safety through a local ordinance by prohibiting an unsafe action, and some of that information comes from our child death review process that I'll mention a little bit later, where we observed a number of children that would drown in that ship canal system, and it's just really not a good place to swim, and it creates havoc for boaters as well. So sometimes kind of just thinking about policy here in general, you're not maybe able to get your organization on board because maybe you have to go through a governor's office or something like that. But we're often free as individuals to do advocacy, to meet with local legislative leaders, to meet with state elected officials, to meet with national folks, to encourage good ideas around policy. The ideal world is you get permissions from your organizational leadership to be active on policy, and then you can supplement that with things you're doing on your own time from your own computer on the weekend or in the evenings, whatever, to help kind of continue to gather those important things that are going to reduce injury out in the community. So one of the things we've done is that we've learned that tragedy can motivate both community work and with getting high-profile media. So the young woman on the right, Susanna Kang, she was a high school student who had lost 2 friends to drowning, and she wrote a very eloquent letter to the mayor and said, "We're just very sad. We've lost 2 of our friends. Can you please do something?" And that made its way to our office, and so we worked with Tizzy Bennett of Seattle Children's and some others to really, let's look at the data. And we did identify that in her cohort, the Vietnamese community, that there had been a number of drownings of particularly young males in open water in there. And so between the child death review system, where we examine each and every death, as well as kind of responding to the emotional plea of this youth, and looking at our medical examiner data, Children's had developed a wonderful life jacket fashion show. So we decided to do one of those where we kind of show off all the latest styles and models, and did that with our parks departments and our youth. And our youth took turns as masters of ceremonies doing that work. So here's a couple of our young community leaders looking great, modeling the latest in life jackets on the catwalk. And, for us here in Martin Luther King County, equity is a huge concern. And so we try to involve the communities of concern, communities that are affected, communities that we need to be involved at various junctures as best we can. So just here's all our models kind of doing a final turn on the catwalk. And what was really fun about this one is a great mixer of inner city kids with suburban and rural kids. And, most of these kids were lifeguards because we were going to put them in the water, and I'll show that in a second. But so it was a great mixer for them to interact and understand and hear the messages as they teach lessons and do other things in aquatics while they grow up. So one of the important critical items that we've discovered is that you really have to demo life jackets in action. You got to show the behavior. So that means putting the people in the life jackets and showing them on paddleboards, showing them in canoes, showing them open water swimming, showing them in small boats, and really describe that. So it is exciting to see that NASBLA is going to be working with occupants, noting that I think it was Lieutenant Wagner that about 54% of victims were occupants, as well as the human-propelled vessels. So as was mentioned in my introduction, I coordinate, I do serve as project director for our traffic safety work, and we've been doing that for about 20 years along with our Kent Police Department. And this is a recent meeting of our traffic safety task force. And part of what we've come to appreciate is that many of our traffic officers, come summertime, they'll transition over to being boating enforcement officers, and they're often dive certified and so forth, and that we can really have good conversations about, for instance, in our state and increasing numbers of states, how is marijuana impaired driving both on the roads and on the water impacting our data and what we're seeing out there with dangerous behavior, polydrug use, opiates and alcohol, opiates and marijuana, opiates and benzodiazepines, all those sorts of things. And so typically our meetings include strategies, learnings from our prosecutor, the woman kind of in the middle there. She's talking about where are agencies having trouble with getting convictions, where are they having troubles with getting blood warrants, what are some of the strategies we can kind of mutually agree on. And so come Seafair, one of our big water efforts where there's lots of drinking on the water, and impaired boaters can become impaired drivers, and what are the sorts of things we're going to do with education about the risks and prevention strategies and planning ahead. And the gentleman on the left in the blue uniform is with the Washington State Patrol, so he'll talk about getting the mobile impaired driving unit. It's essentially a giant van for processing, so that is enforcement officers both on land and in the water bring suspected impaired drivers into the dock. They can do the processing so that our prevention officers, if you will, can get back out there and continue to look at concerns of safety. So this was our spring meeting of our Washington State Drowning Prevention Network. As I mentioned, it's led by state Children's Hospital and some local efforts, and so it includes just all levels of boating and water interest, everything from parks and swim lesson teachers to Coast Guard and boating officers. And so I was really pleased to this spring have Kelly Toth from Alaska, who presented an earlier webinar, do some in-pool demos with what they're doing out there. So that was fabulous for our group. We got Derek Van Dyke and Wade Alonzo, a couple of leaders out of the State Parks Boating. Wade's actually now with the Traffic Safety Commission, so we're getting him in that realm and miss him on the boating side of things. But this was our Where Our PFD photo. And so this is just been a great group and a lot of policy and practice and lessons learned out of there. And Tizzy will describe some of the other efforts that have come from there, including when they Seattle Children's, along with some of the entities I just mentioned, will do a media tour early on, go to the TV stations and start to get some media education and education around policy change or issues. So we've discovered when the weather warms, you need to be kind of poised to do the media when the media has interest. If we try to do some things, for instance, and it's rainy and 55 degrees, we're not going to get a whole lot of pickup. So we work with our local Parks Department as well as our King County Sheriff's Office to kind of just look at the previous year's issues. What are we looking for towards as new issues come to play, and then we'll do a media invite, and it's important to keep it easy for media. So we try to have it close by, because sometimes media has just so many stories to cover, and they're not necessarily interested in driving 20 miles. So if we can have them drive 2 miles, they might be able to squeeze us in. So this is part of beauty of public health and public safety teaming up is that, I'll have gone into our King County Medical Examiner and pulled every single drowning death for the previous year, for 2017 in this case. And I can look at some of the issues that we're seeing, and I'll describe a little bit of emerging issues that we mentioned here. And so I can present, this is a public safety issue, this is a public health issue, this is why, this is how many drownings we had, this is how impairment figured in, and then the law enforcement can, Sergeant Rorvik can, with our sheriff's office, can describe law changes, risks that they're seeing out there, or things that they're looking for when they're examining boating safety. And so this helps build credibility and trust among agencies and with media, so that then as stories develop, media can call any one of us and know that they'll get a good set of information there. So media love learning about boating safety. So little otter on the left, Marta the otter, is what our Parks Department's developed to do some in-schools presentations. So Marta got to go for a boat ride along with our Natural Resources and Parks person. And then the woman's kind of scratching her head wondering, okay, I didn't thought of that, is with one of our local TV stations. And so she did a fabulous story as to what's going on with boating safety in areas of concern. We've had good success with bringing our leadership on board, so whether it's our county executive, our mayor, in this case our public health leadership, our director, deputy director, our community operations person, to, on the wear your life jacket to work day, what it's about, why it's important, and then that way we can continue to be supported in our boating safety, water safety work. So one of the events I mentioned that we do is April Pools Day. So this is at Tukwila Pool down in South Seattle. And we'll typically, get 20 to 50 people to these pools early season in April, when we kind of got opening day of fishing going on. So lots of boats will be out there. Crabbing season will get going towards the end of May. Opening day of boating is early May. So it's a good opportunity for families to go to the pool, to try on life jackets, get some swim lesson information, to get a little bit of boating safety there. And we've just had such good luck with also mentoring and giving new staff, younger staff, opportunities to do media, and they always typically do quite well. So here's one of those events where the lifeguards have, put the life jackets on all the kids. They're in the small boats. They might tip it over to just show how easy it is to tip that boat. But the fact that they're wearing the life jacket will mean that they're going to live to swim another day, live to enjoy that water another day. So this is really fun stuff, and we've done this for over 20 years with our April Pools Day event. This was a few years ago where we did an awards ceremony. The two youth on the left had saved two other youth from drowning at a state park that was no longer lifeguarded. And so our sheriff was able to, part of what we get to do is, as we're writing speaking points for our elected officials, the mayors, the sheriff, council members, is we can insert key things that we want them to say about risks, about supporting resources. One of the key items that I always try to include is that, water safety, parks activities, lifeguards, boating officers, they really aren't a luxury. There's often that sentiment by decision makers that this sort of water recreation is a luxury, and therefore it's often one of the things that's on the chopping block when funding happens, and that this is really an equity issue. It's an important life safety issue, and that it's an economic issue. Drownings cost us millions of dollars. So by our able to insert that key speaking points and things that are issues and things that can be addressed, it helps with doing that policy advocacy. So we took Seattle Children's life jacket fashion show, and we decided to do one on the river. We'd been having troubles with drowning in the rivers, and so King County Deputy Chris Barton on the left doing some photos. We've got our youth, our lifeguards showing the life jackets actually at the river. And this is an area that just has overwhelmed me with just how much usage can occur at times. It's pretty quiet in the river behind us right there for the staging, but in about a half hour later, there was like 100 tubers and rafters and swimmers that went by on this river. And so again, it comes to showing the media, showing the youth, showing the river users that wearing those life jackets is critical to life safety efforts. One of the things that we do is we prepare some precise speaking points. About June we get these out, and so in this case for King County, we saw that 17 people had died in preventable drownings in 2017. So current data helps with getting interest, and part of the concern is we saw that alcohol, drugs are both factored in 70% of the drownings compared to 50% in previous years. So this is both a concern we're seeing on the roads and in the water. So we work on specific messaging, like, the thing that drives us crazy is when somebody says, be safe out there, it's kind of dangerous. It's like, well, that's non-specific messaging. That's really non-helpful. Let's get specific with our speaking points. If we have especially a lot of snowpack in the mountains and it's come tumbling down the canyons and rivers, creating deadly conditions with fast, cold, high velocity water, the safest decision may be to not enter the water. So we'd encourage, and this will lead to sometimes closures by the sheriff's office for all water activities on those rivers until they cool down and get a little bit safer out there. So maybe boating's prohibited, wading is prohibited, inner tubing is prohibited. And so we make those speaking points pretty precise in terms of like describing what cold water incapacitation is. Wear a life jacket if you're going to be out there. Go with a professional guide. And then we include our statewide and local data as best we can that are both helpful to media as well as our first responders. And so whether it's a Marine Patrol entity that's out there, or whether it's a fire life safety entity that's out there doing messaging, it's been just great over the years to see more consistency of messaging that we've worked through in the statewide drowning prevention network, informed by the international expertise of Seattle Children's, Dr. Linda Kwan and Tizzy's work, as well as what the State Parks Boating, Department of Health, and other folks are bringing to us with both data and precision of language. So we're continuing to work on safer sites. It's more related to open water swim beaches. We'll continue to co-lead the statewide drowning prevention network. We'll have to see if there's any legislative proposals as we're getting ready to go into a long state legislative session. I'm not anticipating anything at the local level, but if we get a huge snowpack and logs move around, we'll have to end up working with the sheriff's office on potential early season closures, and along with others, we're going to be looking at this impaired boating, impaired driving issues. And so with that, we'll be taking questions at the end. So thank you.
Great. Thank you so much, Tony. And now I'd like to turn it over to Tizzy Bennett.
Thank you, and thank you, Tony, for kicking us off with this session. It's really an honor to be able to work with Tony and to work with all of you in boating and water safety and injury prevention. All right, let's see, I'm looking to advance. Here we go. So I'm going to focus a little more specifically around policy strategies and how you bridge education and different kinds of interventions with policy. I want to talk about several different ones that we have been working on in Washington State, and anywhere it says drowning prevention, if you are really focused on boating safety, please feel free to put that into your thinking as I refer to water safety. And to think about different partnerships and how there are both the usual and unusual partnerships that you can form, and how we can focus on equity in this pursuit around water and boating safety. So drowning is the #2 leading cause of unintentional injury deaths among kids in the United States. And in Washington State, 85% of our deaths occur in natural bodies of water, like lakes, rivers, and the ocean. And about a quarter of all the drownings in our state are boating related. You know, that varies a little bit from year to year, but that is primarily, it's about a quarter. And of all boating related fatalities, by far the vast majority are drowning associated. And there are still very few policies that we know are effective around open water drowning prevention, and few evaluated interventions. A few of the risk factors: being male, young kids, teenagers and young adults, non-white, and people of color, history of seizures, when teens are swimming in lakes and rivers and experiencing peer pressure or a lack of awareness of water conditions. Young children may just be playing in or even near water when there aren't life jackets being used, when alcohol is involved, lack of lifeguards, lack of competence around boating or being around open water, and then of course weather and water conditions like cold and currents. There are three approaches to injury prevention. You can think about education and interventions and technology. So a life jacket would be an example of a technology, and then policies. The American Red Cross conducted a literature review and an extensive stakeholder interview process to really look at what are the evidence-based strategies as we know today around drowning prevention. And starting from the circle at the top, supervision is the first. Four-sided fencing around swimming pools, learning how to swim, use of life jackets, and lifeguards. My colleague, Dr. Linda Kwan, and others were involved with the assessment around the efficacy of life jackets and have found that in boating-related situations, they reduce the risk of death by at least 50%. So we developed a policy guide focused on 7 different areas to look at how can we move policy system change forward in our state. And I'd like to give you a brief summary of some of the areas that we worked on and what the results were in our continued work. The first is to create safer swim sites. So if we know open water is the leading area for drowning in our state, how can we make swimming and recreating around water safer? So we looked at developing tools and checklists for communities to use to assess the safety of their community, developed guidelines around what does a designated swim area look like that really reduces the risk of someone getting in trouble in the water. And we are currently evaluating how do swim area regulations impact drowning rates nationally, because ultimately you want to put those regulations into place and know that they are preventing drowning. I think that's one of the big takeaways that I have learned around policy is we can pass a policy and feel really good about it, or pass a regulation and feel really good about it, but we don't ultimately know unless we're measuring both process and impact what comes out of it. The challenges that we've seen is there really are, while there are standards statewide and nationally around public swimming pools, there hasn't been a real unified buy-in around open water standards. I think people are worried about risk and identifying their swim areas designated, and then does that open them up to lawsuits and that? And so then there's just been a reluctance. The other thing is that when you enforce a regulation, it can cost you money. And lots of communities around the state, you can imagine how much water we have here in Washington, and I'm guessing that almost everybody here on the phone has a lot of open water in their own states as well, and it is hard to regulate it. And that, so that really makes it hard to make those changes. But we are persisting in figuring this out and really making recommendations nationally. Here's an example of a report card and what that can look like. So you can think about that for other areas of water and boating safety. It helps people to know, what would a good boating safety program look in a local community? What would a swimming program look like? What would a other kind of injury prevention program look like? So then after we developed a set of guidelines, disseminated them around the state, we wanted to see, are people actually using the guidelines? Again, it's a good process measure to see, were they useful? Have people put them into use? And as you can see, over half the people in our initial survey had actually used the guidelines to impact their own swim areas. The next section is around increasing the use of life jackets. And the accomplishments that occurred over the course of our work to date is developing a model ordinance that can be tailored to local communities. While there are some state and national regulations around life jackets, for example, they must be in a boat, that everybody in the boat must have a life jacket available that fits. There are requirements around people who are on personal watercraft or water skis or wakeboards or kids in boats. There are also, for adults and teenagers, there are very few regulations in place. So we thought perhaps a way to get started, if there isn't energy at a state level, is to look at a local level. So for example, in Spokane, Washington, which is on the eastern side of the state, they require life jackets for everybody on a certain section of the Spokane River. And guess what? They haven't seen drownings in that section of the river since enacting that ordinance. So they put it into place at a particularly high use and a risky body of water. Tony talked a little bit about the King County ordinance that was put into place when we had a year of very high snowpack, and it meant we had a really high spring runoff. So they required life jackets in, on, and next to rivers during that summer. And, you know, people were pretty willing to wear those life jackets. They got used to it, and we didn't see any drownings during the period of the ordinance. We have increased the number of life jacket loan programs by at least 10% every year. So we have a statewide list, and we keep an eye on that. If the idea is to increase access to life jackets, what can we do to understand and measure what is available to people, and making sure that we are reaching people across the state. And so we do that by having both a statewide list, finding out where the new sites are, as well as developing a standard sign that helps people know when they come to a site, oh, that's the place where I can borrow a life jacket. We've also looked at life jacket policies in pools and at lifeguarded beaches. So we asked questions like, are life jackets allowed in the shallow end and the deep end? Do you have life jackets available for people to use? What are the barriers to using life jackets in your pool or beach area? And it helps us understand barriers to policy and also where we are inconsistent. So, for example, if our educational messages are encouraging people to wear a life jacket when you're in an open water area, especially if there is no lifeguard there, yet we don't allow life jacket wear when people are in, for example, the deep end of a pool or in the deep end of a open water site, then we're, in a way, we're having some cross messaging, and we can end up confusing people. So bringing education messaging and policy together is really key. Again, one of our challenges has been a lack of consensus around new state level policies. So if we know that the majority of drownings do occur on small boats like canoes or small motorboats or kayaks, then that's potentially an area where we could require life jacket use. It's very hard to look at legislating what adults do in the water, as probably most of you know. And so we have to figure out, where can we begin? What can we do with education and access? And then ultimately move towards policy strategies. Here's an example of the Life Jacket Loan Board that we promote in Washington State, and I've seen these loan boards around the United States as well. We welcome other communities to use it, and we have it available on our website at seattlechildrens.org. I just wanted to show you our original Life Jacket board with the yellow banner and the newer one with the blue banner. We went and surveyed parents and people out at boating sites and swim areas that had Life Jacket loan boards and asked them, did they notice the board? What was confusing? What would be helpful for them? And we learned that, you know, as with really good education messaging, you want your visuals and your message to match. You want it to take you through really clear steps that even if you don't read any of the words, you can understand the gist of what it is. And so the visuals are really important. And to make it simple and more graphically pleasing. So you'll see how we came up with a new design. In conducting observational surveys of life jacket use in boats, the U.S. Coast Guard conducts surveys nationally, and we are part of that national survey, and we have also surveyed dozens and dozens of additional areas in Washington State to understand who is using life jackets and who is not. And we have published this information for those who are interested in more detail. We looked at life jacket use among over 5,000 boaters, and we found that the usage was highest among those groups where it's required. So while there can be resistance to policies and laws, the fact is, when it comes to life jackets, they work. People wear them when you require them. The life jacket use in non-mandated groups was much less, but we did see that adult role modeling significantly increased use for children as well as teens. That adolescents wore life jackets 50% of the time overall, but when there was an adult wearing one as well, they wore one 81% of the time. And so I think that's such an important message, is when we learn through science what does work and role modeling works, whether you're talking about bike helmets, seat belts, life jackets, when the adult is wearing, the child or the teen is wearing one more often as well. I think we are all challenged and really looking for creative ways to engage teenagers. And I love Tony's example of having them the life jacket fashion shows and leading media types of tours and things. And the other is to look at what adults do really impacts what kids do. We also looked at life jacket use in swim areas. So if one of our messages is to encourage the use of life jackets in open water as one measure of drowning prevention, along with swimming in a designated area, knowing how to swim, understanding water conditions, all of those things come into important ways to prevent boating incidents or other kinds of drowning situations. We looked at almost 2,000 swimmers, and we saw very strong age effects and some gender effects as well. So essentially, the younger kids were, the more likely they were to wear a life jacket when they were in a swim area. And these swim areas did not have lifeguards, but they were designated swim sites. And we also found that a little over half of kids 6 and under were within an arm's length of an adult while in the water. You remember when I showed you that circle of drowning prevention put together by the Red Cross and the importance of supervision? We can see there's a great opportunity for education when you have so many parents with young kids allowing their children to be a little farther away from them. We saw some difference between life jacket use, whether kids were within an arm's length or further away. But overall, we found use by teens was very low, even though, as I showed you before, wear rates by teens as well as adults is higher. So you can see that's really a newer message and a real opportunity. The next area that I'm going to touch on is around voting under the influence. And we looked at the old law that we had in Washington State. And what was really helpful in looking at it was to compare ourselves with other states. And that is a great strategy for all of you, whether you're talking about education or loan programs or other types of policy. Is sometimes key stakeholders are really will take note and are influenced by, well, what's everybody else doing? And we want to know what else is going on. So we looked at all of the Western states and found that we had the weakest voting under the influence law. And it really helped us to promote and put together what we thought was a stronger law. We did work with a national group called Change Lab Solutions, and they are a wonderful group, and it might be a helpful resource that we could post afterwards with, say, states around how to connect with them. They're really helpful in looking at national policies and what's going on. So the new law that we put into place changed it from a misdemeanor to a gross misdemeanor, put a heftier fine, looked at implied consent. So if you weren't willing to if you refused the breath test, you could get that fine, and also added in a component around marijuana limits as well. And we are one of the states that has legal marijuana use. So, we got done with that. We all cheered, we celebrated. We're like, okay, now we're going to see less voting related fatalities that are due to alcohol. And it's not as simple as that, as all of you know. There is the continued challenge that boating and drinking are still associated with each other. Now people don't associate drinking and driving in a car. And while there are people who are doing that, everyone knows that is not the right thing to do, and it is not normative, where there is still quite a bit of normative use of alcohol in boats, and particularly among young people. We also looked at how well was the policy being enforced. And what we learned is after the law was strengthened, it actually was not being enforced in any particularly greater way than what we were hoping for. And what we learned was that both marine law enforcement as well as prosecutors didn't have the information they needed to be able to really understand the particulars of the law, how to enforce it, and then ultimately how to prosecute it. And so State Parks Boating Program helped put together tools for people in law enforcement and the judicial system to assist with that. And also looked at whether strengthening our law to consider suspending voter registration and the voter education card would be a way to put more teeth into the law and something to consider. The next section that I'm going to touch on is around surveillance. And Tony really spoke to that at the beginning as you think about a public health approach to your work and the importance of understanding what is going on. And you can think about surveillance in a lot of different ways. You can think about it in terms of what are the number of fatalities or injuries related to, or near misses related to boating or related to drowning or in any other injury area. You can also look at attitudes, beliefs, knowledge that people have. You can look at a lot of different considerations that help inform surveillance and help you move forward with developing interventions. So we have added questions to our state Healthy Youth Survey. Nationally, that's called the Youth Risk Behavior Survey. and there's also an adult version of it. You can actually customize that survey, and I believe we are still the only state that is asking questions about life jacket use, exposure to swimming lessons, and swimming ability or comfort in the water. So that's really something to keep in mind, because that is a standard tool that's used all around the country and administered in schools at the 6th, 8th, 10th, and 12th grade level, particularly in public schools. So it's a great opportunity for you, and I think we've been able to add questions for under $2,000. And then you get a lot of data about what's going on with youth and how are they reporting what they're doing. We also developed a data collection tool because we don't have a standard reporting collection at the state level around drowning beyond what is on a death certificate. And I just have to give a call out to Texas, if there's anybody from Texas on the call today, because I believe they're the only state, and please put in the text box or email me if I'm incorrect, that actually has a surveillance system very specific to drowning. And it really helps to understand it's not just what's happened, it's why it happened and what contributed to it, because that's how we're going to develop education interventions, different kinds of technologies and policies to approach and improve and make our waters and our communities safer. So we created an open water drowning reporting tool that would allow local communities to actually get more detail. And if any of you are involved with child death review, this is a familiar kind of thing that is used with child death review in communities across the country, where people come together, answer questions, and really the point of answering it is to think about, well, what can we do to prevent this in the future? Tony helps lead the child death review in Seattle and King County, and its particular focus on drowning has really helped us in coming together around it. Conducting those life jacket observations is a key part of surveillance. What are people doing around prevention? So as much as you're looking at data and attitudes and fatalities and ER visits and injuries, you also want to look at how often are people doing the right thing. We've looked at newspaper articles, and it's a good way to think about how you can understand what's going on with water-related events, and they may not always be completely accurate, but they are timely and a quicker source of data. We conducted a Can You Really Swim study where we looked at how kids and their parents perceived their swimming ability, and then we looked at whether they could pass the swim test to align what people thought they could do with what they could actually do and what question really gets at that most accurately. Swimming and water safety skills really touches on the equity aspect of this work. And we looked at what is preventing all communities from accessing water. And one of the things that we learned was around, for some communities, they cannot be in a pool setting with the other gender. And they also need to be able to wear full clothing for modesty purposes. And so we actually changed policies in Seattle and King County to create public swim times which are gender specific, to allow women to swim by themselves with a woman lifeguard and to learn how to swim too, and to get that important water recreation and physical activity. Another area was around improving scholarship. So really thinking about, why am I not seeing all the communities who live in my area? Why am I not seeing them in the water or in safe places around the water? And to really think about what those barriers are. I love this picture of Celeste as well. Tony had this picture, and just briefly touching on another aspect of our media and messaging work has been a one-day annual media tour that's been led by our State Parks Boating Program. And it's been a great way to reach out with, what did we learn from newspaper clippings and data the year before? gosh, we were seeing a lot of drownings early in the season because of cold water or because of alcohol or because of currents. And we pull those forward to the next year and really hone in on just a few messages and really try to get the word out. This has now been extended to a statewide media tour, and it's gotten a ton of pickup. It's been really well received. Our partnership, Tony spoke to these. This is why we're all on the phone together. Coming together, the 1 + 1 is more than 2 concept is so important. And to think about who you have at the table and who's missing. It's also been really helpful for us to have parents of young people who have drowned. They bring a different perspective to the table and a passion for the work. And I encourage you to welcome family members as well into your work. So, are we seeing results? Well, I would say those results are mixed and they have varied. And so this is a busy chart, but essentially the light blue line are 1 to 4-year-olds, and you can see since the late 1990s, we've really made some progress with little kids, although you can see there's been a little bit of an uptick this last few years. The dark blue line are 10 to 17-year-olds, and you can see how we were feeling like, gosh, we're really making strides, and overall we have made reductions, but you can see again there's been an uptick, and trying to understand what's going on around that. Is that because our summers are warmer and we have more people out in open water than we did before? Is that because more people are just out using the water? That is a challenge for us, and we have to stay really driven with this work because we still have a long way to go. And then you can see with teenagers, young adults, and then with adults, we have not really made as much progress as we need to. So in summary, we've really learned a lot in this work, and we continue to learn every day. We've learned, as Tony referenced, that a lot of people who work in this field aren't necessarily as comfortable or as experienced with how to promote and change or sustain policy. You know, Tony brought up the how much we can do, even if we are not allowed within our public role to actually lobby for a particular policy. There's so much we can do around being a resource and educating, whether it be lawmakers or key stakeholders, about what the risks are and what we know about prevention. Policies are only as good as the education, the programs, the technology that go along with them. You really have to be persistent. And unfortunately, sometimes a tragedy really does become the way to make change happen. And it is disheartening that that is the case, but sometimes laws change because of a tragedy. You have to consider the political and financial environment. What are people willing to do, and can you take a small step? What's good enough, and not necessarily what you would hope for, but helps take us a step along the way and respects the many different political and financial considerations that people bring to the table. Starting with guidelines versus a policy is a great way to build buy-in, and really making sure the right people are at the table from the start. If you propose a policy and don't have the right people at the table who can then come and push back on it, that's not going to help you. For example, when we put forward stronger boating under the influence law, we worked very carefully with the recreational boater community to make sure their association supported what we were proposing, and they advocated for it as well. Instead of having two different stakeholders arguing at a legislative hearing, that's not the way to get your policy through. And finally, to find that balance between the values of liberty and around public safety. I welcome you to come and learn more. Again, here's another one of Tony's and my favorite pictures. I want to call out something about this picture that I think keeps Tony and I doing our work and knowing we're on the right track is these young people were all having such a great time wearing their life jackets and being part of this effort. And sometimes we may say people don't want to wear them, they don't like them, and I think there's ways that we can really build positive approaches and change behavior and really not assume that there's not a way forward in that regard. I want to thank you so much, and I'm going to turn it over to Ron now.
Great. Thank you, Tizzy, and thank you, Tony. This has been a fantastic webinar series on the public health approach. And the core competencies and the other information provided to us here have given us a great roadmap gaining or strengthening our knowledge and skills and the behaviors needed to implement or grow these types of interventions. Having a little trouble advancing on the slides there. Oh, there we go. Sorry about that. So I'm going to talk a little bit about what's next with NASBLA and what we are doing in the public health approach. Currently, we are developing a microsite within our website that contains curated information and management tools and planning resources related to injury prevention and the public health model. We've got links to safe states on here, the CDC, as well as a list of the state and territorial injury prevention departments so that our members and others in boating safety programs can get in touch with those injury prevention specialists in their own states. To get to this site, just go to NASBLA.org, and at the top you'll see a tab on advocacy, and just go right down there and you'll see public health. That will take you to that site. Another thing that we are building alongside of this is a community of practice. We're using our community platform, it's called NASBLA Connect, to provide this online community to drive collaboration and engagement among recreational boating safety colleagues. And members of this community of practice will have the ability to communicate with each other, share information, experiences, best practices, samples of their work, ways to steal ideas and things like that. And if you'd like to be a part of this community, just send me an email, ron@nasbla.org. I'll show my email later, and we'll be happy to add you to this community of practice. And the easiest way to get there is, again, to go to that public health page that I talked about, and over on the right is a direct link to the public health community on there. We are going to continue doing our 10 most wanted list. We update this annually, and we will do this to coalesce our members' efforts around those priorities that we see in recreational boating that we hope will have an impact on fatalities and injuries. We are going to continue to address the topic of injury prevention, public health, in our conferences and in our workshops. You're going to be seeing presentations on data and using the public health approach and examples that other state programs are utilizing. So be on the watch for that, and those will be recorded and will be available in our e-learning center afterwards. NASBLA is in the final stages of our new strategic plan, of developing that new strategic plan. And we have a number of items in our strategic plan that will go through 2020 that are taking an injury prevention approach to recreational boating safety. And just to name a couple of them, we're wanting to engage entry-level and non-motorized boaters in safety awareness and risk mitigation to increase the safe participation among those populations. We want to expand the breadth and depth of training towards the recognition of impaired vessel operators to include an enhanced knowledge of assessment tools and new trends in drug use. We were going to promote research and development of cannabis detection, enforcement, and training in recreational boating. We're working on that right now. We've been doing some work actually with the state of Washington on this topic. We're developing a frontline recreational boating safety instructor development and credentialing program to ensure the quality of instruction for boating safety education. And we are going to be developing a state government affairs program to advance our members' legislative issues to help out at the state level. Before this, we've always kind of concentrated just on the federal side as a national organization, but we are going to build this state government affairs program to offer that member benefit for our members. And of course, we are going to continue to support the National Recreational Boating Safety Program Strategic Plan. As I mentioned at the beginning of the webinar series, this strategic plan took a new approach and called out the public health approach and injury prevention. And this is a cultural shift for us and a systems shift for most of the state recreational boating safety agencies in the National Recreational Boating Safety Program. And so it's critical that major contributors to the implementation and success of this national program become fluent in the public health approach to injury prevention. And at NASBLA, we're continuing and pledge to do our part to help our members and our colleagues in the RBS community learn more and implement these prevention initiatives. We are also excited about a new grant that we are just starting on implementation of a boat passenger injury surveillance roundtable. And this is going to be tier one of a three-tier approach to improve boat passenger injury surveillance practices. And we are partnering again with Safe States Alliance. Safe States is going to mobilize its cadre of epidemiologists, and we're going to bring experts in boating safety together to engage in a roundtable discussion to identify key surveillance gaps and to develop a summary report outlining next steps for injury surveillance practices targeted specifically to enhance the safety of boat passengers. As we've mentioned before in this webinar, our data tells us that 51% of the people that die in a recreational boating accident are passengers on the boat. And we've always kind of targeted our efforts before on the operator, but we need to expand that and include these passengers. And this is one way we're doing this. A little bit more about this, this project. As I said, we're going to do this roundtable, and out of that, we're going to have a summary report outlining key discussion points, identify the surveillance gaps and the needed improvements that need to be investigated through a surveillance, injury surveillance work group process. And then in tier two, year two, we want to develop recommendations to improve the surveillance of boat passenger injuries by convening the surveillance and boating safety experts from tier one together. And we want to use this multidisciplinary group to examine the important issues and challenges that are facing the states and propose improvements to important public health injury surveillance practices, and prepare a consensus-based recommendation to address these issues. Since 2001, Safe States Alliance has utilized this injury surveillance work group process to identify and support the implementation of improvements across a variety of topics in injury surveillance. And the proposed injury surveillance work group for this project will build on the gaps and recommendations that were identified in that Tier 1 roundtable, resulting in consensus recommendations to improve boat passenger safety to be disseminated to state public health and boating safety agencies online. And then in the third tier, we want to test the recommendations that are identified through this. And we're looking to have a group of about 4 states that will be engaged to test and enhance the recommendations, as well as provide insights to support future implementation by other states. And by implementing these recommendations, the states will be able to enhance their data systems that monitor boat passenger injuries and fatalities, and ultimately develop their own targeted interventions to prevent those events. We also want to continue work and learn more about how we in the recreational boating safety community can use the data that is collected in Whiskers. And NASBLA is going to be working to help educate our members on the resources and how to get them and get that state level data for their use in their programs. And speaking of data, we've developed and are continuing to develop dashboards with visual recreational boating data that will help us analyze the data and help us to share this and tell the stories that comes from this data. And if you go to our website, you'll see a number of these dashboards that we've created. Here's just one on accident fatalities per 100,000 registered boats. And we cut this data a whole lot of different ways. We also have state level data that you'll find on there. So again, we're going to do more of this and continue to do this. So what's missing? If you're interested in trying the injury prevention approach to boating safety, we want to know what else you would like to see NASBLA do to help you. You can, of course, email me or Pam Dillon, who's also working on this. She's the project manager for the Injury Prevention Roundtable on passenger safety. Or you can put your ideas or those things that you need in the evaluation that's going to be coming out after this webinar. Again, we invite people to contact us. My email is ron@nasbla.org and Pam's is pam@nasbla.org. We keep it pretty simple here, and we welcome your questions, your ideas, and we look forward to sharing those with you. And with that, we want to thank Safe States, and particularly Krista, who's been the point person for us at Safe States and helping us put together all of these webinars. And so I will turn it back over to you, Krista, for questions.
Great. Thank you, Ron. And thank you, Tizzy. I didn't get a chance to hop in, and thank you for your presentation. All of them were excellent today. Looking into the chat box, Julie, do we have, looks like we have a number of good questions that we want to provide to our presenters. So.
Sure. So I'll go ahead and read the questions aloud. That way they are in the recording. And if you need a question repeated to any of our presenters, just let me know. So the first question that came in was asking, and I'm guessing this might be best for Tony, prior to the 2013 King County Ordinance, how many drownings were there?
It is something we track. As I mentioned, we go up into the medical examiner records and we look at all the drownings that occurred the previous year, and it's incident based. So that's one of the things to keep in mind. Some of the CDC and some of the Department of Health, your state data will be based on residents. So if a resident drowned in, say, out of state or out of country, they might be included in that population database. But this is an incident-based database. And so I don't have the exact number of river drownings that were related to unsafe conditions, but we do know that we see about 18, 19 drowning deaths per year. About 55% of them are open water, and so I don't quite have the pre and post at my fingertips, but it is the kind of thing we could look up, and it does vary a lot based on how the weather will be. If we have a cold, rainy spring, exposure is less, risk is less, drownings are less. If we get some hot days in May, then we see those cases go up.
Thanks, Tony. So the next question, I believe, would be best answered by Tizzy, and I think actually it's directed to Tizzy. So Tizzy, how can we communicate to partners the importance of a standard life jacket loaner board signage statewide without dampening ownership and grassroots buy-in?
That is such an excellent question, and I can speak from experience as we have been working on that in Washington State. I think I always like to start with what the bigger goal is and to say, this is so great that we are all working together on increasing access to life jackets through loan programs. And then from there to talk about, from a messaging standpoint, that the more we can be consistent, the easier it is for people who go to different water sites to recognize that this is a loan program. At the same time, to recognize that some funders and some organizations have requirements about wording or around visuals that are on a board. We've then took it down another layer to say, can we be consistent by having both pictures and words? Can the pictures or the visuals and the words be as similar as possible across sites, even if the look is a little bit different? Can we work towards that goal around clear and simple messaging, different languages if needed, having photos if you can, or certainly having illustrations versus just words on a board? And actually we've also had the AG, the Attorney General's office in Washington State, look at our boards about some of that wording to reduce risk as much as possible, where it says you're responsible, supervision is still important. So I think those are some ways of bringing it together around what can we do together, acknowledging that there is ownership and people have requirements around different boards. And so we've just taken that approach with, let's just keep chipping away at this and stay true to the common goal.
Thanks, Tizzy. That's really helpful. Let me see. Our next question here. So one, this is just very, they're very thankful and for your collective work, and that the webinar is very informative. But could anyone tell me whether, let's see, can you tell me whether anyone has cataloged a list of best practices in employing the public health approach, especially for boating safety? So looking to see if anyone knows of a catalog of best practices around boating safety using the public health approach.
This is Ron. I'm not aware of one. I would love for our community of practice that we're setting up to be a place where we can help do that. Tizzy or Tony, do you all know of anything?
I think the way you've set up your site, Ron, is so exciting and is a place to be able to put that information. The World Health Organization has published some evidence-based strategies around preventing drowning, and there are some that are boating specific. So there are like different places where you can find pieces of it. I can do a follow-up, and we can send it out afterwards to see whether there is a single site, but I believe it's still somewhat spread out with Safe Kids having information, NASBLA, World Health Organization, CDC. It's a great suggestion, though, and let's see if between Tony, Ron, and I, we could at least put together some links to have in one place, even if it isn't one list.
And I'm going to add in that this is an excellent thing to think about for a public health master's student. They're just so great at doing literature reviews. So depending on what Tizzy's able to identify that's out there, working with your local university in your area or your state on a public health project like this would just be an ideal way to roll it up.
Great, thank you. I think that'd be really helpful. And if we can compile all of that, we can add it to the website where this webinar will be archived. And so folks can access it there, along with, I'm sure, the NASBLA site. Let's see, the next question. So this is somewhat of a question and statement, but the Coast Guard will soon be developing the next iteration of the strategic plan. Are there any particular projects that leverage the public health approach you recommend for inclusion? This is somewhat related to our last question, I think, around evidence-based approaches. But if you know any specific projects that could be leveraged and the Coast Guard could add, and this person says you can think about it and answer later. So if it's part of that follow-up document, I think that would be helpful.
Yeah, and hopefully the project we are working on, the roundtable on passenger safety, will come out with some of those recommendations too.
You know, one of the tools you might look at as you develop that is with fatalities is there's a national violent death reporting system that's being implemented across all states through CDC, and it brings in law enforcement records with medical examiner records, coroners, and toxicology stuff. So that's been a recommendation for actually the traffic safety field to look at how the National Violent Death Reporting System is rolling up data. The traffic safety world has the FARS, the fatality analysis research system, and so that's been a good effort. So I think those two things would be good to look at on the fatality side of things, and as you look to develop the surveillance systems around fatalities, and then Whiskers with injury and some of the other injury surveillance systems will be good to talk with some of those folks at CDC or some of the state users of those data sources.
This is Tizzy, and the one thing I would add is, at the beginning of my portion of the presentation where I showed you that circle of drowning prevention, that the American Red Cross convened a large group of stakeholders, and they really went through and looked at the evidence and really pushed out, this is what we know now works. This is what we need to learn more about. And I think it would be helpful to have that very clearly stated, that when we know things are making a difference, then for all of us who are practitioners in the community to know, okay, I don't need to test that this works or not. We know it works. Now I need to think about, for example, what does get people to wear life jackets more often? Or what does work to have people follow other boating safety practices? I think evidence-based versus, and even levels that might be from, we know it from a research study to its expert opinion to, these are promising strategies, or these strategies haven't been trialed on diverse communities and we need to do more of that. So maybe a layering of that might be helpful with that next strategic plan.
And Tizzy, as you mentioned that, another potential tool to look at is how the traffic safety community has, with National Highway Traffic Safety Administration, they have the NHTSA countermeasures that work, and it's like I think a 1 to 5 star system. And so, you know, if you're up there in the more stars, that it is a proven best practice if implemented with fidelity. Fidelity will reduce traffic-related deaths. If you're in the 1 or 2 realm, it's like either needs more evidence or it's not so good. So there's maybe one model to potentially look at, is in addition to the World Health and some of the other organizations Tizzy was mentioning.
Thank you both. Thank you both for that. And I see that we're getting close on time. There's not another question, but Kelly Toth from, I believe, Alaska has offered a couple of insights here regarding the work that they're doing, and that I will, I guess, just read out loud for everyone. Is I guess the group in Alaska is working to catalog best practices currently, so that's exciting. They are just kind of right in the middle of that, writing a new chapter specific to public health, specific to boating safety. She also mentioned that both Alaska had a group temporarily, and I think this was a comment during one of the presentations regarding child death reviews and boating, around the boating data. And that is that Alaska had one temporarily and revisiting it now. I believe that Orange County, Florida has a drowning database. That the maternal child health reviews is where they learned a lot about the public health model, and now creating a drowning summit modeled after the death review, the maternal child death review process, with a diverse group of professionals. So I think Kelly is a good contact if you are looking at creating databases, doing reviews, and looking at those evidence-based or best practices. And that appears to be all of the questions and comments at this time.
Okay, great. Thank you, Julie. Go ahead, Tizzy.
Oh, Chris, I just wanted to give a shout out to Kelly, and as you're looking at who has this expertise around public health and boating safety, she's definitely one of them. So really glad you were on the call today, Kelly, and thanks for sharing that information and resources.
And with that, I would like to thank everyone who participated in today's webinar. We hope that this was informative and helpful to your work. There is a resource document you can find in the handout section of the webinar control panel. I'd also like to take this time to thank our speakers for their wonderful presentations. This webinar, along with the others from the series, will be available on the Safe States Training Center and NASBLA e-Learning Center. And just a reminder, you will be receiving an email following this webinar with a link to the online evaluation. We love feedback, so please take a moment to fill that out for us. And thank you again. You may now disconnect.